welcome. We have Professor Dr. Sebastian Bonhoeffer from ETH Zurich, Professor Dr. Roger Kouyos from University of Zurich, Ralf Richter of SAP, and he's also a mentor of this hackathon. Hi, everyone.
Hello.
Good to have you. Okay, I will start with you, Ralf. You participated in the Vir versus Virus hackathon in Germany, which took place, I think, a week ago or so. Also a mentor. So just for us to understand a bit what they were working on, tell us what were the highlights that you saw there.
Yes, this hackathon had, I think, over 40,000 participants, and Slack had at the beginning also some problems with getting the load handled, and there were also some live submissions on YouTube. And in the end, we have seen 1,000 people in DevPost, and they created over 1,500 submissions. So there were a lot of different categories, from hospitals, from how to support the local community, and how to help also small businesses, these kind of things. And so they have created 1,500 submissions, and I was also then reviewing part of them. So I think they had over 450 mentors, if I'm right. At least this was the number I got from the YouTube podcast, and every mentor got between 10 or 15 projects to review. And I have seen really a lot of great examples, and so favorite ones, for instance, was chatbots like Corina.chat or Coroni chatbot, which is a very interesting solution, also with anonymous contact tracing or some risk assessment on it. And yeah, this was more or less my impressions from last weekend. I think, if I'm right, on Sunday, they will do the final judging, and we will hear then the news from Germany.
Okay. I'm just going to address our audience again, as I just forgot to mention that, of course, you can also tell us what you would like to hear from our experts via the chat on YouTube, and then we will take some of these questions in as well. Okay, thank you very much, Ralf. Let's go over to you, Sebastian. Tell me what exactly, how are you fighting COVID-19? I know that you're part of a ETH task force domain that is looking into it. Just tell us what you're doing.
Okay, thank you, Tanya. So my name is Sebastian. I'm a professor at the ETH Zurich, and in my normal life, I work on what is referred to as infectious disease dynamics. So we have actually done quite a bit of work on how pathogens replicate, mostly actually within a host, i.e. within a patient, but we also have done some work in epidemiology. And so the mathematical models that are behind that are quite similar to the mathematical models that are currently used in order to predict this epidemic. Now, at the moment, I have a particular role. You mentioned this. This is, I'm part of a task force that has recently been called into life. This is from the ETH domain. That means actually the federal university, as well as the federal research institutions in Switzerland, where we felt we urgently need to join forces in this crisis. And this has actually picked up quite a bit. So it's actually now becoming a nationwide activity in order to really use the know-how, also the direct support that can come out of academia in order to help troubleshoot problems in this crisis. And our main goal really is just to help wherever we can, to help in particular the critical forces that's in the hospitals, the people doing the testing and so on. We just want to offer our help and make things possible. So that's where I see my role at the moment.
And how exactly do you want to help? Is it by, as I understand, also synthesize or aggregating all this data that is around? As I understand, there's a lot of data.
Yes, I mean, here I'm talking perhaps a little bit about the specific situation in Switzerland. I hear that many international people are here, but the situation in Switzerland is, in terms of the data that is available, perhaps different from other countries. So we have been working very hard to try and assemble critical data for the epidemiological dynamics, and that's not straightforward to do at all. But what I would also like to emphasize here, that it's of course very important to get accurate and correct data and also make sure that these data are carefully checked. And that's part of the problem. So what I try to do is to help in various ways, ongoing activities, people like the people that are now in the hackathon, but also other people, really in order to make sure that the data that we can have, we will get, and also as much as possible to make it open source. But it is really a challenging time. Everyone is working at their max in order to make this possible. And as I said, our role is to try and help, and then with this data also enable the community of modelers and who can use this data in order then to make predictions, to, for example, estimate critical things like how well are the measures that are being taken, how well do they work, do we see progress, and things like that. That's what we're trying to do.
Okay, thank you very much. Roger, you as well work with a lot of data. You're currently at the Universitätsspital, so the University of Zurich hospital. Give us a bit of a hint what exactly you're looking at.
So again, the main difference is between what I would have done before the crisis and what I'm doing now. So in my former life, I would have done research on what I would call quantitative infectious diseases. This means applying quantitative and computational methods to assess the diversity of data and the diversity of questions in infectious diseases, ranging from immunology to the transmission of pathogens and so forth, mostly in HIV, bacterial pathogens, antibiotic resistance. Also important to keep in mind problems that will stay with us even after the current crisis. Since in the last couple of weeks, as I guess for everyone else, I have reduced my normal research activities and focused just to try to help the people in the hospital wherever I can. I must say in this, I'm doing research in infectious diseases. I'm not a clinician myself, but I try to closely collaborate with clinicians. And so I have been trying to offer my help wherever it's more useful than a burden.
And right now you're actually really on the ground in the hospital. You see behind the scenes. How has it changed since the outbreak of coronavirus?
I mean, in the sense that, people in the hospital are always busy, but these times it's just crazy. Everyone is doing overtime, night shifts, from the clinicians to diagnostics. So it's really a heroic efforts of the people on the ground.
Do you see anything right now there that you can think of that the people that are now hacking could maybe come up with a solution that would help the people on the ground?
Yes, definitively. So, and I think a lot of efforts have already been done in that way that have been helpful. Essentially, I feel one place where the community can be useful is in terms of helping to synthesize available data. So initiatives like in Switzerland, again, coronadata.ch have been very useful just in bringing basically publicly available data together and helping to synthesize such data, and partly also analyzing that data. So beyond that, my general opinion is that, my own opinion is that, but I guess everyone else sees it in a similar way, is that as is natural for a new challenge, the field is very diverse. There's a very broad range of opinions, a broad range of initiatives, and to a large extent, this is also good. But I think what would be very useful is to synthesize this diversity into, into what is the necessary diversity, and not to have basically 100,000 private opinions coexisting.
Yeah, I would like to take Sebastian in, because you mentioned to me before we started the stream that to you it's also important that this data is verified, right? This is something that worries you.
Well, worries is perhaps a little bit is too strong word, but I think still we really need to consider the aspect of ground truth, as I called it earlier, of the data. A lot of the data that are openly available give a link to where exactly the data comes from, but in such times where everyone moves fast, it's often the hard job of actually looking at the quality of the data itself is perhaps not done always in the way that it might be required to make stable inferences. And I think the more central these data are, and I think that is sort of the data on cases, confirmed cases, recovered cases, deaths, and so on, and perhaps even data on hospitalization and so on. These data need to be as exact as possible, because these are key for measuring the impact of the interventions that are done. And so here I think it's very important that one takes great care at making sure that the data that is used is the best possible data that one can use. If I can perhaps add on to what Roger just said, I think the synthesizing aspect is also something that I would very much emphasize. And I think this is something where also the community here can perhaps think about appropriate platforms where information, it's also, there's tons of information out there. People are publishing papers, reports, and so on. And the possibility to generate a knowledge base where people can comment on the quality of findings and so on, where we can synthesize the knowledge that is out there in the community, that I think these kinds of efforts would be super helpful. I'm not saying that it's easy, because their experts also disagree on opinions, but still, for governments at the moment who have to make tough decisions, it's very difficult if there's lots of diversity of opinion, but no clear consensus of whether this is a minority or a majority opinion. And I agree that this is best done really by experts in the field, but there's tons of experts out there. And I think to synthesize that information, and there is global information, but there's also information that is relevant to particular countries. And I think that is also something that needs to be taken into account. So it's not necessarily what works for Germany or France or Italy would work for Austria or Switzerland. So these information also needs to be gathered in a context-specific manner.
Okay. I see Ralph was actually nodding a lot while you were talking. So I guess, Ralph, would you like to add on that?
Yeah, I can add something on this topic. So in the past, or in the 19th century, we had the Great Stink of London, which was the cholera outbreak. And then a famous epidemiologist, so John Snow, he started with the dot diagram, and then there was a water pump around in Soho in London. And there he dotted all of these cases or confirmed cases, and was able to analyze then these kind of data. So what we see right now also in the hackathon is a lot of different apps which gets programmed, who are, let's say, are an evolution of these kind of low fidelity dot diagrams on a sheet of paper. But we see things like the Corona self-report mapping project, which is one of the hackathons, and where they report geolocations and other solutions. Also, I have seen in Germany in the hackathon, they were collecting these kind of information in electronic form, and so on and so forth. So one important aspect was also about what is happening with the data. So as you just said, was also there are it's a very diverse landscape. There's a lot of information out. Also, a lot of information gets collected. I believe it's very important to have open access to these kind of data, to share these data and make sources of information available, because these data will help to contain the outbreak. And this we also have seen in other cases.
Thank you very much, Rolf. I actually see that there's a question coming in from our audience. So I'm going to read that to you, and it's from Nicolas Plechko. He is asking, how is your prediction of a similar epidemic happening in the future? How useful will the tools that are now developed be in the future? And in brackets, it takes a lot of time to make these tools really usable. Is there anyone that
maybe I can add something to it. So in 2014-15, we had the Ebola outbreak in Africa, and in Germany we had a consortium called EBOCON, which was I think 15 different research projects, from data collection, how to deal with data, how to do contact tracing, and with partners out in academia, and also us from SAP, we had to get the initial app developed. Now this is open source, and it's continued as SORMAS with the Helmholtz Center for Infectious Diseases in Braunschweig, which is helping to let's say, get these contact traced and also developed. So I think if this would have been done much more sophisticated, or with a certain, let's say, importance, we would have been a better solution for this kind of preparation to get the relevant data.
So you're basically saying if what we were doing already years before could already have been helpful now.
Yes. And I have also seen they have developed also a module for COVID-19, and looking forward to see also further development on this.
Okay.
I would like to add to this. I think indeed the tools will be helpful in the future, and we also don't know really whether a second round of this outbreak might also come. I mean, this is a total possibility that once measures are relaxed again, and we have to observe here China very carefully, then that there might be new outbreaks coming. So I think what is developed now might indeed be helpful in the future. Also, I think there's an interesting interview, I'm sure many of you have seen it, by Bill Gates, where he actually said what he thinks are the major risks that he might encounter in his life. And global pandemics, that and that's, I don't know, 6 years ago, he said something like he rates that as 50%, that he would see that in his lifetime. And unfortunately, he was right about it. So I think also we continuously have new epidemics, small and large, and hopefully not soon one again of this scale. But I think a pandemic preparedness is a good investment in the future. And so I think that also makes sense that some of the projects are long-term, but nevertheless, I would say keep a focus on stuff that helps now at the moment, but don't forget about also useful projects in the long term. But I think we are in crisis mode at the moment. So something that really provides something very soon is of particular importance.
Yeah, we can see that. I guess we heard a lot from Asia, or from, let's say, Korea, or because they had these experiences with SARS before and were much better prepared in that sense, or because they just, you knew what was coming somehow.
Is that a question to me, or
no? It's just a comment. It's just a comment because you said, we have to be prepared, and here in Europe, we SARS or the swine flu never really came, and therefore in Asia they already had experience and they could build up on it. And talking about Korea, Ralph, earlier before we started the live stream, you also mentioned how they tackled the issue. And we also spoke about data privacy. And this is something that we here usually like to protect, but maybe you can put that a bit into perspective.
Yeah, this is the topic of data available and how to share the data. So we in Europe, we deal with these kind of things very differently. We know, or let's say mobile phone companies, mobile provider companies, they know exactly how many people are logged into a certain signpost. And then you can, let's say, get a certain visibility, how many people are in the same area. And for sure, in big data cases, you also can locate those infected ones in the same area. And you just need to add 1 and 1 together, and then you get your results. So in Europe, this is, let's say, a highly sensitive topic at the moment. How these data should be used. At least what we see in Germany is an anonymized version of how people are moving around inside of the country. You can see this on various news channels. And in Korea, it was used directly with feedback to those people, and then automatic messages were sent then to people around these kind of things. So this is from a technology perspective is possible. So I believe society might have to deal with these kind of questions. And I think this is also a topic which is addressing the question of Nicholas. So how we will deal in the future with these kind of things.
Exactly. And then there's also the question where to store the data and all that.
Exactly.
Specific. Then we have another question from the audience, Marlon Lückert. What do you think about virtual or augmented reality for visualizing and interacting with all the data? Roger, you want to go ahead? Or
no, I'm just wondering. I don't have a clear. I don't have a clear vision on how this how this can be used. It can certainly be useful for, I guess, for training purposes, but I don't see at the moment a direct application. If I may add, however, briefly to the previous.
Go ahead. Yeah.
From other countries, what to learn from South Korea and so forth. One hears this commented quite a bit, but one should also keep in mind that these are individual examples, and in biology settings, its own particularities, and to what extent the course of the epidemic in countries like South Korea and the apparent success of those countries in controlling them was related to one or the other control measures is still uncertain. So sometimes I feel, in the same sense as Sebastian has said, that the data is uncertain. So at the moment, so individual data points, so are what is perceived to be facts or effects at the moment. So because we are in crisis mode, we are perhaps more willing to accept preliminary facts as causal effects and as basis for recommendations than we would under normal circumstances. So I would also not overgeneralize that, and in the same sense, in the same way, I would also keep in mind the societal trade-offs in implementing one or the other solutions, especially if those solutions are based on uncertain effects, uncertain facts, and also can have massive or quite strong impact on what we perceive important goods as privacy.
Maybe an answer also to Marlon, how to use virtual or augmented reality in this field. So usually we from our own organization, we produce solutions to help workers in a warehouse where they pick certain pieces out of a shelf, and they can use also those smart glasses, and then they get exactly the location of the article they would like to pick from a certain shelf. And so solution could be possibly used for people who are out in the field doing contact tracing, where they get some additional data, let's say in their view on, like you see Google Street View or Google Maps, then you see you're working out in the field, and then you get your information in from a system where either contacts are located or where you need to visit people. These kind of things could be feasible, I believe.
Mic muted. Thank you, Rolf. We don't have much time left, but we have another question coming in from Alison Mitchell. How much of a challenge to data interpretation is the variation in testing policies between countries? Are there methods already used to adjust normalized reported data? Shall I?
Go ahead.
I think very much so. I mean, there is across countries, there is a very large variability in testing rates, and this can be very obviously seen also by the large variability in the ratio between detected cases and number of deaths to COVID. That's one fact. But what should be also kept in mind, and that makes the situation even worse, even within one country, the testing policies can basically shift on a weekly or even faster basis, depending on guidelines, directives, availability of tests and things like that. So it may be that we test more frequently, have been testing less frequently last week than we have done before, and this makes the entire interpretation of the curves of detected cases very difficult. The question also mentioned the issue of normalizing the data for testing frequency, and I couldn't agree more that this is an important a very important topic. It is probably there also very important to keep in mind what the process of testing is, or what the algorithms are used on the ground are to decide whether someone is tested or whether someone is not tested. And again, this can vary both across countries and by time.
Thank you very much, Roger. We actually still have 2-3 questions, and I would like to still give a bit of time for 1 or 2 of these. So as mobile tracking is a really critical topic, do you think that it would offer a significant bigger value than the data already available from hospitals and other institutions? Yes.
I can say something on that. As it's formulated here, a significantly bigger value than what is already from hospitals. I would say, if I had to say this data versus the other data, then I would say I'd first like to have the data from the hospitals, but that's not the question at the moment. So I think the question is whether there's an additional value here. And then I would say very clearly, and here in particular, again, I saw some analyses in Switzerland where they have used data, again, from mobile providers to see how much there is compliance with the measures that have been put in place, and to see that sort of on an age segregated level, break down what age fraction is actually accepting these measures and how much travel distance has changed. And yes, I think that is super important to see how much these measures really work. So I think there's a huge value in these additional data.
Sebastian. Then we have here another one. I don't know if you can speak to that. Probably it's more a medical question, but what do you think of self-made cotton face masks? Does wearing cotton masks make sense for low risk groups? Is there an official source for this? I don't know if anyone has an answer to this. Okay, I guess this needs to go to a doctor, or yeah. And then we have, would it be an option for Switzerland to adopt a mandatory app for social tracing and health reporting like the one used in South Korea?
Here, I would say one thing is the entire privacy issue, but the other thing that in my understanding, and I'm sure the crowd out there knows much better than I do, is one of the problems is a lot of people are trying to develop apps at the moment, but I think both the Google and the Apple platform will not actually provide any of these apps unless endorsed by the government or by official parties, and therefore I think at the moment the biggest bottleneck in this is actually to say, if we choose an app, which one would that be? And therefore I think investing enormous amounts of time into the development of such an app is actually quite difficult, because it's, the government will not allow 10 of these apps. Mm-hmm. And so I think this is potentially, in my personal view, I'm speaking here really personally, that's potentially a sink of time to develop something like that, because eventually might only be one that actually makes it. But the one that makes it will be very important. Okay,
that's actually a good tip for our hackers out there. So not everyone needs to look into a tracing app, because as you said, Google and Apple won't allow if it's not an official by the government, right? But nevertheless, it will be worth to have a good one.
Totally, yes. And there are huge initiatives. I mean, it's not that people are sleeping here. I mean, there's huge multinational initiatives at the moment which are pushing at the very, very highest level to get actually approval across Germany, France, Switzerland, and so on. So there is big movements in that sense. So it's not that the field is sleeping here.
Okay, good. I just got a comment, Sebastian, are you available for questions out there? Someone is asking if they can reach out to you. Probably very busy.
I can, well, I'll try. But what I would like to ask is that, indeed, like for everyone else, it's a crazy time. I really want to help. And if do try and send me questions, please be understanding if I can't answer everything, but I'm here to help.
Okay, thank you very much. And I guess you find your contacts are online with one.
I think it's not easy to hide.
Okay, so I would like to close the round, but just maybe as a takeaway note, is there anything that you would still like to tell our hackers or everyone else out there that is doing the hackathon? Maybe Ralph?
I think so. 2020 is the International Year of Nurses and Midwives. So.
Oh yes. Oh,
yes.
I'm sorry, I forgot to mention you're actually a former nurse.
Exactly, and for sure, there's overall a shortage of nurses, and so if people could also think about nurses and find a very nice solution for them. And to get help for them, especially for returning nurses who are right now working in desk jobs or who are in different other industries right now. They might need help also in terms of how to get re-educated or get information made easy, accessible. I think that's very important, and happy to see if somebody would like to take on this kind of challenge.
Thank you so much, Ralph. I totally had this question on my list, asking you about your nursing experience, but we got into the data. But that's good out there for people to think about. Sebastian and Roger, anything that you would still like to give our audience?
I just would like to say a huge, gigantic thank you to everyone who is involved in this. I mean, I'm trying to dedicate my time at the moment, but I'm so really moved and humbled by how everyone puts in this effort at the moment. And this is one of the great things that actually we see at this period of really severe crisis. So my biggest thanks to everyone, really.
Thank you, Sebastian. Roger?
I have nothing to add to that. It's really great to see how people come together in this crisis, and everyone tries to contribute according to his abilities.
Thank you so much. There are also people thanking you here on the chat. Thank you so much for joining us. So I will let you go if you have to and want to. Otherwise, there are a few people in here that are taking from the teams that are hacking. I will take them into the conversation. We cannot have everyone, but if someone wants to stick around, maybe Ralph, you as a mentor. Otherwise, you're also free to go. Thank you very much for joining.
Thank you.
Okay,
thank you.
Thank you.
Bye-bye. Okay, so we are now going to add some of the hackers and team players that are out there. I actually haven't spoken to them. I'm just going to add people that are waiting in the line, and I think I can have 6 people at the same time. And one more. I think that's everyone. Hi, everyone.
Hello. Hi.
Hi.
Hey, how are you?
Good. How are you?
I'm doing pretty well.
Fine, thank you.
Good. Thanks for waiting. Let's make a quick round. Maybe I start with you, Justas.
Sure.
Where are you from? What are you working on?
So basically, whole our team is from Lithuania, and we're working on a data gathering tool. And the points that the experts touched before is basically very valid. And I think to answer these questions, we first need to ask if there is already data source that we can use for this kind of data gathering tool. And apparently, we were thinking quite a lot, and apparently there is. And this tool is called Google Maps Timeline, right? And Google Maps Timeline is really gathering all the places that you've been since you have Google Maps installed, apparently. And for most of the devices, it's already enabled by default. So basically, even people don't know that Google is collecting this data. And my team has found a way to extract this data and extract only a tiny bit of it. And basically what happens here is that we're using a big data, the Google vast data sources, and we extracting very, very small bit of this data. And then we taking only 3 weeks of the people's whereabouts, and we storing only the people who identifying themselves as positive with this virus. And we're storing it only this data anonymously on the databases of our databases, and all the rest of the people, they can do the same extraction of the 3 weeks where they've been, and they can see if they were at the places where potentially they could have this infection also. So basically, it's just a kind of advisory service on the last 3 weeks of the locations that you've been. That's the whole idea. Basically, it's very simple, and the good thing that you don't need to install any apps. Google is already knows where you've been for a very long time already. We're taking only 3 weeks, and we're checking if there is any collisions with those who are identified positive.
Okay, thank you very much for sharing your idea. Let's go over to Alex Vanino.
Sure.
Yes, where are you from? And let us know quickly what the idea you're working on.
Sure. So I live in the United States. I'm on the East Coast, right outside New York City. So my idea, I'm the team leader for a project called CheckUp on Me. It's an app for crowdsourcing wellness checks. And that's a project that I've entered into code versus COVID. So it's kind
Alex, the sound quality is not very good. I don't know.
Sorry?
Yeah, that's better.
Okay. Are you good? Okay.
Not very clear. Yeah, if you can just restart, that would be great.
Sure. So I'm Alex Vanino. I am in the United States, right outside of New York City. The project that I'm entering into code versus COVID is called CheckUp on Me. It's a app for crowdsourcing wellness checks. So to kind of explain the app, let me explain the inspiration of the idea. So, we've entered into these really strange times, and we're self-quarantining alone. You don't leave the house without your mask and gloves. It's actually really become the norm. And unfortunately, what's also become the norm is the fear and anxiety that a lot of people are experiencing dealing with these situations that we're now facing every single day. I actually have this friend who I play online games with. And it's who I got the idea originally from. He has lupus. It's a disease that affects the immune system. He's also the type of person who's a complete loner, and he just loves it that way. But recently, this lifestyle has presented a couple of problems for him. His condition makes him extremely susceptible to COVID-19, and the effects from it would be extremely severe for him if he actually did get it. This makes going out and doing simple things like getting groceries a lot more dangerous for him than it would be for a person with a normal immune system. On top of that, since he really doesn't have a whole lot of people to rely on, most of the time he really doesn't have a choice but to go out to these stores and actually take that risk. Now, can you imagine that, risking your life so you can go and get groceries? I really can't imagine that either. So that is the situation that I don't think anyone should ever have to be in. And that's a problem that I'm trying to solve with CheckUp on Me.
Great. Thank you. Maybe let's just quickly stay with you. How is it going? Do you have everything you need at the moment, or is there anything that you need from the community or maybe from one of the mentors? We have Rolf still online with us.
I do. So we are in need of some help. We're looking for people with development experience related to the open source project Spoke, but it's okay if you don't have that. The open source project is a Node.js and a React project, so if you know any of that, we could definitely talk, and we'd definitely love to hear from you. We're also looking for people, they don't have to be technical, that just have healthcare and public safety experience to join our team as volunteer coordinators and advisors. And of course, we're going to need volunteers to actually check up on people. So when we release the app, we'll definitely be letting you guys know.
Okay. And how can people reach you? Slack or? Yeah. Okay. Great. Thank you, Alex.
Thank you.
Let's go to Berin.
Yes. Hello. Nice to meet you. My name is Berin Iwlew. I've been in web tech for 25 years, and I'm the project lead for the COVID-19 Response Network. Earlier this month, a friend of mine and a local community organizer, Jay Slaby, started a simple website to help assist people in Battle Creek, Michigan during the pandemic. Jay linked to some forms and spreadsheets on Google for people to request and offer help, created a time bank, and put together a community resource guide. So inspired by her, I put together a dynamic website built using the Umbraco content management system, which can be easily localized to other languages. We have already accomplished something great, as it is already helping people in need here in Battle Creek. For example, we were able to quickly create a form to volunteer for the Share Center, which is a nonprofit organization that helps feed the homeless in our community. This project is very personal to me, as I'm in the high risk category. I want this network to help the most impacted communities of COVID-19, no matter where they are in the world. The sites built around the project will help to better organize local communities and to provide a hub for people to seek and offer help and to look up the resources and services available to them.
Thank you, Berin. Is there anything that you are still looking for the community? How is it going?
It's going great so far. We have a website already up and running. We've got some community organizers here in Battle Creek that have stepped up that are willing to contribute to it. The main help that I need right now is a connection to Umbraco headquarters to find a experienced Umbraco developer. We're also looking for community organizers in their own areas for their own websites. This is going to be a ground up thing. We're looking for a staff manager, web designers, and anybody that wants to help, really. This is going to be big.
Well, how quick do you need these people? Is it still until Monday or?
Well, just when people can get to us. I mean, everybody's working at their own pace at the moment, and a lot of people are still working part-time jobs. So I mean, if people want to join us, they're welcome to at any time.
And what's the website called that you said you'll have up?
It is battlecreek.covidresponse.net. Let me share this screen with you real quick. It should be shared now.
We can post it in the chat.
Okay, we can post it in the chat. It's battlecreek.covidresponse.net.
It's been shared.
Great. Thank you. And if anybody else wants a demo of the back office, I'm willing to show that off as well. It's really easy to use for content contributors and translators. We just need to train them.
Thank you. We also shared, by the way, checkupon.me as well from before. Thank you.
Thank you.
Let's take Sherry Chun in. Hi.
Hi, everyone.
Hi.
I'm Sherry, and I'm from Taiwan.
Welcome.
Yes. So,
what are you working on?
Yes. Our collaborator and I are working for a project called My Log 14. It's a project initiated by My Data Taiwan Hub.
Yeah. Your sound.
And I think everyone should already know that Taiwan has so far is doing a good job to prevent this disease to spread out. But we need to be more humble and continue to continue doing the good job. So that's why we have the idea of My Log 14. So we want to create an application for to use the technology to help citizens, especially for the people who are under home quarantine, to check their own status. And all data is kept locally to preserve privacy and citizens' rights.
Okay.
And this app is also providing information to help the citizen to know better what they should do under what type of condition.
Sounds good. Thank you, Sherry. And how is it going for you? Are you still looking for help out there from the community?
So we after joining the hackathon, so we have some a lot of excellent volunteers join our team. So we are now working very well, and we have some. We have also designed the UX UI, and now it's doing the development stage. And if there's any help, I think we need a lot of alpha testers. So anyone who are doing the home quarantine or you want to do the quarantine yourself are very welcome to join us to be an alpha tester.
Thank you so much, Sherry. Thank you. I'm going to go. Is there anything that we should share on your side, like a website or anything in the chat? Or
our website is still under the creation, and we had a very good wiki page, but it was written in Chinese, so I didn't share it with you. But if any one of you are interested with the progress, you can join the My Log 14, the Slack channel, and we can discuss more on the Slack channel.
Sounds good. Thank you, Sherry. I'm just going to bring Justus in because. Do you hear me? Justus?
I couldn't hear you. Sorry.
I just wanted to ask if you needed help from the community, because I didn't ask you at the beginning.
Yeah, no problem. Yeah. So basically, we are a team of 9 right now. We really nicely split into teams right now, and as we all Lithuanians, we're talking in Lithuanian, and yeah, for the moment, we really coping with the load quite well, and we have really good experts. One of us is a medical expert, and he's fighting with this virus directly, and he's advising us a lot. And we have a really good development team. Lithuania is quite good developers, so we are quite strong in that. So for the moment, no, but yeah, everyone is welcome to join us, and I leave their feedback. So thank you.
Okay, thank you very much. Thank you everyone for joining your insights. It's great to hear from you. And of course, if you or everyone else that is out there hacking right now have any questions, you can write to your mentors or connect via Slack, of course. So I'm going to leave it there right now. The next live stream session will be tomorrow, Sunday, 9 a.m. Swiss time, for a meditation. So I hope you join then. And otherwise, let's maybe see each other tomorrow. And good luck for everyone. Yes? Thank you very much.
Peace.
Thank you.
Bye.
Thank you very much. Have a good one.
And good luck.